And through the funding of Open Society Initiative for West Africa, OSIWA, they are the sponsors, the funders of that particular, the whole of South is Imo, Ebonyi, Anambra, Abia. People as field officers to go through these places to get us clips, videos. But because you're here, because we want to show you the job, tell the whole world what you've seen, our efforts, what we are doing, and intervene, because what we saw were very, very pitiful. Like they were sorry sights.
We did not go to private schools. We did not go to church schools, and from the private schools and the church schools.
The fact that you have compiled this into a book form, I'll pray, give us copies of this so that we can.
Even the ladies from the first, but these are born here. I could see that kind of school. It was something bad. So we're here for you to see what we've done and for you to take the message and tell the whole world that there is need for intervention in primary schools in the Southeast. And there is also need for intervention in health centers in the Southeast.
But we know that the local government councils have constitutional duties and responsibilities that they're supposed to be doing for us. And they are the closest government to the people. I remember when I was growing up as a child, I did not come to Owerri for anything. I went to my local government headquarters, Iho. That's where we did everything. We had a bank there. We had every service you needed. That's where we went to. But now we don't know what the local government people are supposed to do for us. So we realize that the local government councils have some constitutional responsibility regarding provision of primary health care and provision of primary education. So we decided to look into this to determine how well they are doing this work and the status of primary education and primary health care in southeastern Nigeria. Of course, as a non-profit or what you call an NGO, we usually depend on funding and grants from funders and grant makers. So we approached Open Society Initiative for West Africa, OSIWA, and we shared with them our plans and what we wanted to do in the Southeast. And they really loved our idea. And they said they were willing to fund us for the project. So OSIWA solely funded this project. What we wanted to do, as you can see in the document that I shared with you, was to enable youths to demand for accountability and efficient delivery of public services by local governments, and by evaluating performance and publicly recognizing best performing local governments. Because we realize that our young people, members of our society, are not engaging, they are not participating in civic engagement. And we know that governments all over the world must be held accountable by the citizens. But in our own case here, like in Imo State, in Southeast, in Nigeria, our young people are not holding the government accountable. They are not asking questions. They are not curious. They are not inquisitive. And some of them do not have the skills. Some of them do not know how to do it. Some of them do not have the capacity to, hold the government accountable. The government, democracy is the government of the people, by the people, and for the people. And so the people should be able to know what their government officials are doing, whether they are elected officials or they are appointed officials. So part of what we wanted to do was also begin to raise that awareness in this part of the country so that people can know that they have a constitutional duty, they have a right, they have rights as citizens to be able to ask questions about public service delivery in their locality, in their state, and in their country. So we decided to work with a team of 190 young people that we selected from across the Southeast states. And we trained them in various things. For example, we trained them on how to read the Constitution. I know that many young people do not know how to read and understand the Constitution. So we trained them on that. We trained them on how to track the budget items for their local government. And the beautiful thing that we selected these young people from their local government, from their communities, so that they are able then to hold their local councils accountable. And we got them from all over Southeast, from the 5 states in the Southeast: Imo, Abia, Enugu, Ebonyi, and Anambra. And we trained them and we sent them into the field to go and take a look at our primary schools and our primary healthcare center and get information from us how those places are. In this country, we like to do them say. Everybody is saying, oh, the primary schools are bad, the healthcare centers are bad, but nobody has facts. Nobody has data. So we decided that we want to go see things ourselves and collect data. Now, we didn't just go there doing our own thing. If you go to the Ministry of Education, primary education in Nigeria, or if you go to the Universal Basic Education Commission, and then you go to the National Primary Health Agency, Development Agency of Nigeria, they have what they call minimum standards. So every primary school has what they call minimum standard that they must meet. They must meet. And this thing is done by the Nigerian government, by the Ministry of Education, by the UBEC Commission that oversees, that monitors activities of primary schools in Nigeria. We also have the National Primary Healthcare Development Agency that regulates the activities of primary healthcare centers in Nigeria. And they also have their minimum requirements. I mean, we have a lot of policies, beautiful laws